Magic words. Call this meeting of the Parkview Health Center Committee to order. We'll go to item 2, approval of the May 18th minutes.
I'd like to make a motion to approve the 18th minutes.
Second. Second, any corrections or additions?
Not that I saw.
All in favor of approving the May 18th Parkview Committee minutes, say aye.
Aye.
All opposed, say nay. Carries. Item 3, public forum. Anybody join our Zoom? No? Okay. We'll close that portion and go to item 4, the financial report.
All right, so for May, percentages should be roughly 42% of our budget through the 5 months. If you look at our revenue, total revenue, we're sitting at around 40%. The biggest item in there is the miscellaneous operating grant revenue, which is still trending quite a bit above where we had budgeted, so that's good. Go up to the top part, the intergovernmental is 36%. So with the lower census, that's still a relatively good number. Along with the private pay. Nothing too dramatic in the revenue section. And to total labor, we're sitting at 32%. Trending good with labor. Travel is only at 18%. So yeah, I know in May there was quite a few conferences, so guessing a lot of stuff will hit in June for that. The capital outlay section, we did bump up a little bit. The new scrubber came in and it is working wonderfully. The staff really appreciate that down in the basement. So you clean the floors and whatnot. So then going further down into the other operating area, nothing is standing out too big in there. A few items. We had replaced about halfway down. There's other electrical products. We did replace a bunch of the older bulbs in our atrium area with newer energy efficient LEDs. So that's why that's a little bit higher. I foresee that going much higher through the rest of the year. The heating and power that is running, the power is running pretty good. The heat, which we used most of it in January, February, March, so that will be down quite a bit through the rest of the summer, and then going up a little bit towards the fall. Other contracted services, or the next section, the contracted services. The building repair one, I know they did replace some fire doors, so that's why there's a little bit in there. That's a little bigger. And then the professional services in the top of the 4th page. That's our contracted staff that we have coming in, and that's running at 28%. So that we're still looking good there. And overall, if you take out the other transfer out, which is the ARPA money. We're about 1.4 million ahead of where we had planned to be with the applied fund balance. So we're doing real well there.
Questions?
The actual is 15, expenses total
15 million. Yes.
15 million.
Yeah. That's with 8.6 million of ARPA money coming out. Yeah.
What happened to the washing machines, dishwasher?
That's that just finalized last week or Monday or 2 weeks ago.
Yeah.
So that's in and it's working good. I really like it.
Did that money get transferred to the Spirit Fund? 8 million.
Yeah. Yeah.
681.
Yeah.
638.
It came in 2022.
Formerly known as the ARPA.
Yeah.
Yeah.
Fund.
Yeah. It came in 2022 and goes out in 2023. They wanted to do that in 2 different years.
Right.
And then I have a question about the fire door. Was that one of the items that we had as a things in the budget last year that were not opted to include?
No,
Okay.
no, it was noticed while we were going through our life safety inspection.
Although we did have budgeted for repair of that door and the doors for the kitchen.
Yes.
We were just going to repair it. It wasn't going to be made into a fire door. But the doors were getting pretty well beat up. So we were going to replace them, but not with fire doors.
Okay, so the request and we did not move forward with that request, right? That was
No, that was actually put back in by John, wasn't it? Wasn't that in it?
It was, we requested it, but it was denied.
Oh,
Okay. And so what made you decide or realize that we needed to make the fire doors versus just replace them?
So during our life safety survey, we realized that the size room that it encloses is large enough that it should have been fire doors. They did not give us a citation for it, but we were doing that to behoove it because they should have been fire doors. So we got a citation for those doors being propped, but we did not get a citation because they weren't fire doors, but we probably should have, because they should have been fire doors. So we replaced them with fire doors. We added magnets to them, mag locks, so they can be propped open, and they're wired with the fire system. So when the fire alarm would go off, those automatically would be cut off and they would shut.
Okay, perfect. Thank you. Anything else? All right, then we can go to the administrator's report.
Okay. So for May, our daily census was 98. So operating at 58% capacity. We had 7 total admissions from the hospital, and then we had 6 total discharged, 4 to home. 1 went out to the hospital and 1 expired. We had 4 transfers out to the hospital and 4 that came back to us. 1 was within 30 days of admission. We currently have 31 people on our waiting list as of right now. So our census is pretty average for 2023 at about 98 for total census. Private pay is at 19%. Medical assistance or Medicaid is at 71%. Family care, which is a type of managed Medicaid, is at 4%. 0 for insurance, 3% at Medicare Advantage, and 1% of Medicare.
Question.
Yeah.
Waiting list. What is the reason for now waiting because of, we don't have a COVID issue,
No, we don't have staff.
we don't have staff.
Mhm. Yeah.
Would you need to open another wing to accommodate this waiting list? Is that it? You don't have the staff to do it.
Correct, yeah, if we could open another unit, we absolutely
You could
would.
fill it up.
Yeah.
You could find spaces.
Mhm.
How many staff do you need?
To open a wing.
To open up a wing, well, we need to. You know, 21.
21 certified?
Yep, so you need about 6 nurses. And you need the rest to be CNAs. Mhm. So besides that, besides the census, like Doug said, the dishwasher is in. That project is completing, it's up and running, it's doing good. The water heaters, they replaced the water heater that is no longer functioning. So they did that last week and they came back this week. No, they're coming back next week. This week, they replaced the one that was not working. That seems to be up and running, functioning good. And next week, they're gonna return and replace the other 2 then.
Oh, the other 2.
Yes, we had 3. Mhm. Yeah, so the building can function on 2. We had one that was broken and one that was leaking. So the life expectancy of that one was up in the air.
Yeah,
Right.
you did all 3 of them because it made sense. To do them all at once and they have the same useful life.
Yes. Mhm.
Makes sense.
Mhm. So, so that's been completed, the make locks were done. We did have a couple air handlers on Prairie Side and Woodside that went out, those needed to be replaced. Meaning they didn't have air conditioning over on that side of the building. So those were just recently replaced to at the end of May, so those probably have not hit our financials yet either. So we had to get a crane and everything to get those taken care of. Stuff happening.
Yeah.
A lot of stuff happening.
The distance between billing and payment of those bills is about a month.
Yes.
Okay.
Yeah.
Total staff for May, we had a total staff number of 173 with a turnover rate of 4%. RNs, we currently have 14 open positions. We have 53 CNA positions that are open, 13 hospitality aides, and 2.5. Let's just say two food service staff members. So.
We'll move right along. Item 6, a discussion and vote on the revised incentives resolution. Give us a little background here.
Yeah, so I'll talk a little bit about this. So we did, there was a resolution that was passed last June. Last June, there was a resolution that was passed. We asked for it to be revised in November. Since November, we've had to ask the county executive twice to offer double time to all staff due to circumstances. We couldn't get people to pick up, holiday weekends, we needed people, dire straits. he had to go against the resolution and do an emergency order to go against this twice. So he does not want to have to do that again. Therefore, he requested that myself, Ethan, and Mark come up with a plan to make a resolution so we can just put this to bed and be done with it. So he does not have to go against the resolution moving forward. So in order to do that, some of this is, I should say, most of this is going to stay the same. The biggest change in here would be the per shift incentives that we would be able to offer people to pick up per shift starting at $25 up to $150. And we wanted that because if we were to do that for part-time and casual status, we didn't necessarily have to offer them double time. We could offer them this incentive that may get them to a double time incentive. Does that make sense? Instead of just having it outright that we could offer them double time.
So what changed here from the June resolution on that?
From the June resolution, from June to November, we added that salaried staff or exempt staff could pick up above and beyond their required 40 hours to receive $68 an hour. We had salaried staff that would be willing to pick up, but there was no incentive for them to pick up.
Okay.
Or we had staff who were a social worker, may have their CNA license. There's no incentive for them to come back and work on the floor as an aide, and not being able to flex their time either.
So number 2 was a change.
Number 2 was a change from June to November.
Right.
And then I think the double time was the same, and the time and a half, I believe casual people were added in there.
Where's that?
Number 4.
Because how it stands right now, we couldn't offer double time to a casual call person.
Was that wasn't in June or November at all? It's just added to this.
I think, I believe this is what was added in November of 2022.
Time and a half and double time.
Was the time and a half to casual call was added. And
it's not double time. It's not double time. It's time and a half.
Correct. And so we created a policy, which is the second document of how this would be implemented at the center. Just so everyone could see that.
Is that a report, agenda report?
No, this would be a center policy, which is not something that this committee necessarily votes on, but it states here in Number 5, the nursing home administrator reports to the county executive, director of human services, and to the Parkview committee monthly on use of the adopted procedures. And just for your reference and good faith, we attached what the policy would be at the center. And this also has to be, this policy is not just approved by me, it also has to be approved by John and the director of human resources before implementation.
And they've seen this already, so it's.
They have, yes. And this is why it was taking a couple months to get here. We had to agree on a policy, but also a resolution, so.
When you go into incentive staffing situations, is that coming out of your regular pay line?
Yes, it's coming out of our budget line, or our labor budget line.
But within that labor, it's regular pay, right?
Actually, I think it would come out of overtime.
Overtime?
Yeah.
So would that would be true for like exempt 40-hour salaried staff as well as that casual call that is picking up their 17th hour?
The actual, if exempt people would pick up the additional 68, I think that comes out as regular time. Okay. Because that's just an additional, it's just an additional wage, okay, for them.
Not particularly, I guess, relevant to this resolution, but it does feel a little convoluted that the pay, like incentive pay is such an important part of the way you set up your staffing, and yet it's hard to see where that is, in the same way that it's like very easy to see where we have overtime or contractual services, and obviously every department sort of shifts these things around, based on like what their needs are. But I just think like we know that this is like not, it's not like we use the word emergency, but like that's regularly in this type of emergency where we need these incentives. They're not sort of arbitrary. They're something that we almost plan for in a way. But anyway, I don't have any other questions about it or anything. Yeah.
Could one employee have a tremendous amount of incentive pay in a year?
Oh, yeah.
How is that governed? They could. They could. Kind of like, I'll give an example. The Rick Grant in prison, there was a fellow that had a lot of overtime, but wanted to do it, and the others didn't step up. So that employee won't be critiqued on doing that. It could be a workaholic employee or a dedicated. Yeah. Okay.
We have a few.
I just have one question. When you fill that vacancy, you go to the pool. Years ago, people fight for overtime, a time and a half and bonuses. So they had to distribute it, and they did it in a seniority way. How do you do? Are you just begging everybody?
It's a first come, first serve.
Put a list out there of these are the open positions. First people that sign up for it get double time if it's a time slot that is one time slot, if they're willing to pick that up, the first two people that pick up for that time slot, they get double time. The next person, if it's still needed, gets an incentive, not double time, just time and a half for that.
If they qualify for double time, they have to qualify for it. So, well, I'll say some numbers for Doug's example. Say we need 7 CNAs for a shift. We have 7 openings. We need 14 to run the building. We have 50% of what we need. But to get to minimum staffing, to do bare minimum, we need, we'll say 4. If we have 4 to get to minimum, we'll offer maybe 1 double time shift and 3 time and a half shifts. But it's a first come, first serve. So if they want the double time, they have to pick up first, but they also have to be a 0.8 or higher to qualify for the double time. Otherwise they get time and a half.
That's where I was going. So you have 3 people and they all want it, who gets it?
Yeah.
But you say there is a labor grade, so to speak, and it goes by that first. What if 2 of them are in the same labor grade? And they both sign.
first person that gets,
So where
makes a call.
Yeah,
where you post it, do they like go running to sign up? She, they fight?
we send out, I wish it was like that. We send out an email,
Oh, okay.
yeah. Yeah, they all get an email with all of the open shifts. Mhm.
Good.
Yeah,
I don't know if that's a problem or not, it doesn't sound like it is. Where people
No.
fight over it,
no,
I know where I worked, they fought over it, but it was big bucks back then.
but we've had, since we changed that to waiting for people to pick up and then nobody's picking up and then doing incentive, doing it this way, we're seeing a lot of improvement of people picking up right away versus
You would
waiting
do it
to
for
the last
money.
minute.
I was just kidding, yeah.
How much lead time do you have? Like, I would assume sometimes you don't have much time to fill those slots. But is it when you're doing your scheduling that you can see you're short?
Yeah.
Is it like a week notice? Something.
We do it, so we do for nursing, I'll say, they do an 8-week schedule out, okay? The casual status people, they have to pick up their required shifts before the schedule is posted.
Okay.
So we know about 2 months or so, okay, where we're sitting. Mhm.
Any other questions?
Just a quick one.
Yeah.
What if one signs for it and then something comes up and, hey, I can't make it? Do they get relieved or do they get penalized?
They really should be finding their own replacement. Once they pick up the shift is theirs. Yeah.
I'm just asking, you know,
Yeah.
find your own replacement.
Yep, once they pick up the shift is theirs,
Okay.
and they need to find their own replacement, and if they don't come in, then it goes against their attendance.
I understand that,
Yeah.
but I didn't know if there. Where I worked before, there was a weekly overtime, we called it, and then there's daily overtime. And so if somebody couldn't make it or they called in, which list do you go to? Well, you went to the daily, and then we had people that did the weekly and said, well, if I would have known that, I would have signed it just to done service.
If there's no other questions, then we can have the committee, decide its course of action. Yeah, so we would like to make a note.
Yeah, I'll make a motion to approve the revised incentive resolution 140-11202 as presented.
Second.
Any further discussions or comments from the committee? All right, then we'll take a vote. All in favor of the revised staffing incentive proposal, say aye. Aye. All opposed, say nay. Motion carries. All right, item 7, suggested topics for future agendas. I have to add executive staffing updates.
Yeah.
Anything else? Then our
that probably should have been during open meeting or whatever. I had something happen, a committee bringing a resolution to me at P&M. And compared to the resolution which I knew that they had voted on, okay, it had been changed. The changed resolution was never voted on.
By the committee?
By the committee. I pulled that resolution off my agenda and told them, I gotta take it either back to the committee or they've got to change it back to the original resolution.
Okay.
No ifs, ands, or buts on that. It becomes invalidated the minute you change a word on a resolution. Okay?
Mm-hmm.
And have not voted, made a vote on it.
Even if it's a typo?
even if it's a typo,
Okay.
it's found a change on the resolution from the time that it leaves the committee to the time it gets to me at PNS, okay?
Mhm.
And I catch it, it's gonna get jerked. Okay? That happened with an ARPA resolution that it came to me in my last PNF, and I've still got a little fight going on that. So, just so you know, here, you gotta be sure of what you're voting on. And don't make any changes to the resolution now that we voted on this. Okay?
Thank you.
Good information.
Our next meeting will be scheduled for July 20th. We'll also celebrate the 54th landing on the moon together at 3:30.
Oh, that's way before my time.
Wow.
And if there's nothing else, then we'll go for an adjournment.
I so move.
All in favor, say aye.
All right.
Aye.
Thank you all.